Speaking of feedback, that's one of the advice often given to interns and residents. Always ask for feedback. The thing I've noticed is that academics are terrible at giving feedback. We are not trained in personal relations and often don't want to hurt people's feelings. And so then medical students and interns can sort of get vague, generic, positive feedback and then be surprised by something negative in their reviews. So rather than just saying, how am I doing, or what can I improve, pay attention to what they say and don't say. So when you are giving your rounds presentation, pay attention to the questions that the resident and attending asked. So if they asked very basic questions that you definitely covered in your presentation, that's suggestive you're getting lost in the weeds, your presentation was too long or too fast and didn't emphasize the important key information that they need to even just fully understand the problems. But if they are asking for a lab that you didn't mention, that's totally okay. It's not that they think that's a huge oversight. That's reflective of a thought process that you can review in terms of interpreting the patient. And the more you can try to follow that logic for why that lab that you missed was important for the attending to decide on the assessment and plan, the more you can improve in terms of your clinical thinking. And then if they potentially agree on your assessment, but they're recommending something different from your plan, again, that is helpful feedback for you to take into account. It doesn't have to be just somebody seagulling. It can be helpful to reflect, or if there's time, ask about what led the attending or resident to come to a different conclusion. It could be concerns based off of the patient's demographics that maybe weren't taken into account. If somebody was older and you needed to be less aggressive, or if there were some interactions and medications and comorbidities that you didn't take into account, or just hospital processes that you might not be aware of. So think of the entire rounds and how they respond as your feedback, rather than expecting them to come up with things on the fly, because again, it's very hard to give useful, concrete feedback. If they do, great, take it and run with it. But otherwise, this can be a way to continually try to improve throughout your rotation, rather than waiting towards the middle or end for their feedback, which may or may not be useful.